Travis County, where you
Larry,
get
wait
to...
for the cue from us.
Okay. Good evening. Welcome to this special presentation from Travis County as we meet and greet the three finalists for the position of County Executive over Health and Human Services. I'm Larry Schooler, and I'm pleased to be your moderator and host for tonight. We look forward to hearing your questions as the candidates introduce themselves to you one by one. We'll have three candidates total. Those of you joining us on Zoom, welcome. We want you to engage actively and respectfully, sharing questions in the chat window with co-host Shelby Slutzker. Again, if you have questions for the candidates and are joining us on Zoom, you can go into the chat window and send a message directly to Shelby Slutzker with your question. We'll do our very best to incorporate it. Also, if you're watching us on Travis County TV and you'd like to call in and have your question recorded, you can call 1-800-304-1055. That's 1-800-304-1055. You will speak to a team member who will take down your question. You should know that we are spending about 30 minutes with each candidate, and so we will do our very best to get to as many of your questions as we can. Quite a few of you submitted questions ahead of time online, and we greatly appreciate that. We'll do our very best to cover as much ground with each candidate as we possibly can in the time allotted. If you have any tech-related questions and you're joining us on Zoom, send a chat message to Casey Hoffman. For tech questions only, Casey Hoffman is your contact. And for questions for the candidates on Zoom, please chat those to Shelby Slutzker. And once again, a reminder, we are broadcasting on Travis County TV, and this video will be posted following the event. Well, I think we are just about ready to welcome our very first of three finalists. And so I'm going to be welcoming and saying hello to the Vice President of Community Development at the Housing Authority of the City of Austin, Ms. Pilar Sanchez. Ms. Sanchez, welcome. Good to have you. Guess we're waiting for just a moment for Ms. Sanchez to be brought from the waiting room. So we'll stand by for her. Later, we'll be hearing from Roberto Duarte from Montgomery County, Pennsylvania, and Lawrence Lyman, who's currently with Travis County. There's Ms. Sanchez. Hello, good evening. I think you might be muted, so we want to make sure we have your audio.
Yeah, good evening.
Wonderful to see you. Thanks for joining us. I think the first question that would be helpful for us to hear about from you is just why this job? What made you want to become the next county executive for Health and Human Services?
Well, I've been at the Housing Authority for over 22 years, and I've always been an advocate for those who need assistance the most vulnerable individuals and families here in Travis County. And I love working there because I get to work with families directly, talking to them, meeting with them, and seeing how they grow, seeing how they remove barriers themselves, and sometimes they ask us to help them remove barriers. And but the county, this opportunity allows me to do that at a much larger level, at the county-wide level versus at a housing authority where we serve about 1,900 families.
And I think it's probably self-evident to a lot of folks, but can you help us understand how the work at the Housing Authority has best prepared you to be the best selection for this position going forward?
Sure. I've done a little bit of everything at the Housing Authority. I've been there since 1997. And when I started there, I was the director of admissions, and I was hired to re-engineer their eligibility process that had created a bottleneck. There were over 300 units that were boarded up and unused, while we had over 10,000 families on the wait list. And even since then, that experience helped me get to where I'm at now and to understand how it's so important to remove barriers and to understand that sometimes the bureaucracy that we think is necessary really is only a barrier to the much needed services that our families need. And so we were able to fix that issue. And since then, since 97, we've been at 99% occupancy level and have kept it there. But that experience was so empowering for me to see how I, as a one individual person, can help so many families with basic needs like housing. And then I moved on to create and launch, design and launch the Housing Authority's first revenue generating subsidiary. And that has also shown me how important it is to find creative ways to bring in new resources to serve our families. So we created a subsidiary. That subsidiary makes millions of dollars, and we pump that money back into resident services. So I'm so proud of that experience. I oversaw compliance for a while, and through that, I learned and helped our departments of the Housing Authority how to reach compliance, how to re-engineer their programs to be more efficient and effective. So all of these experiences have brought me to a place where I can take my leadership skills and see a project or program, a department, understand where the needs are, and help the team come up with a comprehensive strategy to meet the needs of a community. So it's been a great experience.
It sounds like it, and thank you so much for the detail that you're able to share there. There was a question submitted ahead of time that I think is probably something that would fit into your professional wheelhouse. It asks, the affordable housing crisis and affordability gap continues to widen in Travis County. Name three things you feel Travis County may be able to do to close the housing affordability gap. And obviously, in the context of the role you might take here as county executive over HHS.
Well, first of all, I would hope that the county would, and I would recommend if I was honored enough to be selected, that the affordable housing efforts be brought together under HHS, because right now they're in different places at the county. And so I hope the county will make good use of my affordable housing experience and my redevelopment experience. Um, and so I think what we need to do is bring all those components together under one area, Health and Human Services. Two, we need to develop a comprehensive affordable housing plan. My understanding is that, like I said, there's just pieces in different places, and we need to bring that together and develop a plan together with the community and with all the divisions of the county coming together and developing that plan so that we can build new affordable housing. That'd be the third, build new affordable housing. But I would also add that we need to, if we're not the builders, if we're providing any kind of funding or approval letters that are very valuable for tax credit developers, if we're providing any of that, we should really use that to influence the final product. So we should ask for family units, bigger units, more amenities, more accessible units, more common space for health and wellness programming, wraparound service programming. So I would use that influence to make sure that even developers that aren't under the county, that they are meeting the needs of our residents here in the county.
The challenge with a session like this is there's so much I'd love to follow up with you on that particular answer, but we have so many different topics that folks who have reached out want us to cover. So I'm going to jump from housing over to criminal justice, and we got two very similar questions sent in ahead of time that both essentially ask, how do you see Health and Human Services interacting or working with the criminal justice system, and how might you try to carry that out if you were selected?
Oh, that's a great question. I see them as vital partners to each other because there are several services that HHS can provide that can help with prevention of preventing people falling into the criminal justice system. And there's also a lot of services that HHS can provide to help people through their second chances and through their rehabilitation phases. So whether that's providing uh, medication treatment, uh, uh, medication assistance treatments, whether that's helping with behavioral health and wellness programming, or helping with job training, job retention, so that people there, reduce recidivism. So
Sure.
there's so many programs that can help someone either avoid getting into the criminal justice system, or if they're there, helping them rehabilitate, removing barriers so that they have those services that they need to be successful. Versus right now, a lot of people will get a second chance, and there aren't programs that are easily accessible for them to really have a fair chance. So I see those two divisions working very closely together.
And I've worked in the past with the city on fair chance hiring, so I know very much your choice of that phrase is very apt in this context. I appreciate that. A couple of questions related to funding. One of the questions that was submitted ahead of time was, how will you ensure funds are distributed equitably throughout the county? And if special funds are received, how will you ensure these monies are quickly and efficiently distributed?
Well, I had the privilege of running the rent assistance program at the city, and that was one of the things that we were tasked with. Finding where are the people that need these services the most, that usually have a hard time accessing services, and then how do you remove the barriers for them to be able to access them. So we want to make sure that services that are available are easy to access. A lot of the times there's eligibility criteria or eligibility processes that just make it really difficult for people to get into the program. So I would want to make sure that we reviewed what are the barriers to accessing these and making sure that we remove them. Um, and if we did receive additional funding, I'd conduct a quick analysis of where are the greatest needs, what zip codes, what census tracts have the greatest poverty rates, eviction rates, and then we would overlap with where we have already provided a lot of assistance and identify where the gaps are. Where do people live that still haven't accessed funds and still need assistance?
There is a question that is a little bit similar, but in a slightly different framing. And it asks, how do you prioritize between the full spectrum of all people in needy populations that Travis County HHS serves internally and through external investments? Specifically, what client populations are the most important to serve?
Can you repeat that? Did you say how would you advertise?
No, it said, how would you prioritize between the
Prioritize.
full spectrum of all people in needy populations that HHS serves internally and through external investments, and specifically what client populations are the most important to serve?
That's a really good question. I think it's important for us to understand our population first and foremost. And so, in order to understand, you've got to listen first, right? Stop and listen. I'd hold some listening sessions and invite the experts to the table to tell us where it is that the needs are, and help and ask them to help us prioritize. And when I say experts, I'm not talking about consultants and researchers. I'm talking about the people that we serve. They're the experts that can tell us, what is the source of their challenges, and what can we do to best meet those challenges and help them improve their lives. So I would really tap into our residents, and see, try to better understand our population, and then we would prioritize based on the greatest need, and then we would try to match the resources that are available to each of those needs.
An interesting question regarding the delivery of service in the age that we're living in, unfortunately, still mired in the throes of the pandemic. The question is written: a large number of people at Travis County HHS are working remotely due to COVID. What is the best way to provide quality services in a compassionate manner in this situation?
Well, I'm really glad that they used the word compassion, because one of the things that I insist on when I work with people is that my team have compassion for the people that we serve. Um, I think that we have to be able to see people in person. There are ways for us to protect ourselves, whether that's through social distancing, wearing masks, getting vaccinated, getting boosted, and still being able to be on site whenever possible. Not at all times, of course. You want to limit contact as much as possible, but there are ways to have meetings in somebody's front porch. That's what we do at the housing authority. Meet them at their front porch, sit more than 6 feet apart, and listen to what they have to say and understand what it is that they need. So I think that we need to invest in digital inclusion. If we're going to provide services remotely, then people need to have a computer. They need to know how to use it, and they need internet. So all those three things come with digital inclusion: a device, training, and internet access. So we would have to do that in order for our constituents to reach us and for us to have meaningful conversations, even if it's through a computer.
You're just joining us. You have joined us for a meet and greet session with the three finalists for the position of County Executive for Health and Human Services at Travis County. This person would succeed Sherry Fleming, who is retiring after a long and distinguished career. I'm Larry Schooler, joined by our first finalist, Pilar Sanchez. We'll be hearing from two other finalists here in the next little while. Pilar, a couple of more questions for you while we have you here with us. There are a couple of questions that have come in here in the last couple of minutes that I want to try to have you address. Um, One, I think I partially know the answer to, but it would be good to hear from you. The question is, how long have you lived in Travis County? And do you feel you have similar experiences and can relate to those that HHS serves? And if so, can you tell us more about that?
Yeah, thanks for that question. So I'm originally from El Paso, and I came here when I was 18 years old, back in 1989. I've been here over 30 years. And as a woman of color, um, growing up in a household with 8 siblings and a household with very low income, and as a person who came to Austin for college with only $300 in her pocket, that I had to stretch for months before I got my scholarship money. I understand the challenges that our communities face, and especially those communities that we serve at the Housing Authority and the communities that Health and Human Services serves. And I don't understand everything, and that's why I like to sit with our clients and learn. And I like to give them the opportunity to design the things that they need based on their own beliefs of what would really help them improve their lives. Um, but yeah, I've been here 30 years, the youngest of 8 siblings. And you can imagine with those kinds of numbers, it was a party at my house every day growing up. So I think that's probably why I'm a very playful and happy person.
It's funny, I'm the father of two, and it seems like a party at my house. I really can't even begin to imagine the scene at the Sanchez home. So that sounds really interesting, or exciting, or both. Um, just wanted to let folks know I've seen a couple of messages come directly to me here in Zoom, and it would be great if folks could direct questions in Zoom chat to Shelby Slutzker. She's one of our co-hosts that you'll see when you pull up that menu. It's hard for me to keep track of that and be focused on my conversation with our finalists. So again, if you're on Zoom and you'd like to direct a question to the candidates, please do so in a direct message to Shelby Slutzker here in just a moment. Let me see. There was another question here that I think you've partially begun to address, but I'd like to ask it as it's written. It says, what do you want to accomplish in your first 6 months if you're selected for this position?
Oh, that's a great question. Well, if I had a 90 day to a 6 month plan, I would I would start first with conducting an analysis of the current state, identifying the greatest needs of those that are living in Travis County, identifying the resources that are available to us, meeting with my peers and my team at the county, but also meeting and listening to the people that we serve. Together, holistically, we would find a balance between pandemic times and post-pandemic times. Second, I'd celebrate what we've learned, and I would identify what we did really well and incorporate those new learnings and new tools, uh, those best practices into policies and programs. Um, and then I would take a deeper dive. Once we did that, I take a deeper dive with all of these groups, right? The teams of the county, the residents, to develop long-term strategies that worked on prevention and addressing our community's greatest challenges. Those challenges are in mental health, violence, substance use disorders, the lack of affordable housing, homelessness, chronic disease. We can go on and on those challenges, but we would create plans, comprehensive plans. That means all those divisions coming together to help with the planning, to build upon the existing and new prevention services on behavioral health counseling, wraparound services, job training, retention, youth education, digital inclusion, like I talked about, health and wellness, violence prevention, medication assisted treatments, childcare, transportation assistance, finding all of those pieces of the solution, and coming up with comprehensive plans for each of those challenges.
A lot to get done. I don't want to see your sleep schedule in those first 6 months for sure. Um, kind of Someone let us know that there is a significant audience of Rosemont residents, Rosemont and Oak Valley residents joining us tonight, and a question was submitted ahead of time. I'm going to read it verbatim and ask you to answer it as you'd like. The question reads, please indicate whether you agree or disagree with the following statements. The county and HHS have a role in ensuring that tenants in county-involved properties, including SHFC properties like Rosemont at Oak Valley, are treated with dignity and respect, and that a situation like what happened to tenants at Rosemont and Oak Valley should not be allowed to occur again. Please explain your answer, including what steps you think can be taken to ensure tenants in county-assisted housing are better situated in the future.
That was a long question, but let me see if I can address that. Yes, I do agree that the county can have an influence over properties who receive funds from the county, who receive approval letters from the county. All these properties looking for that letter of approval to get their tax credits, we're looking for funds from the county, should sign an agreement that they'll develop a relocation plan and an anti-displacement plan for the county's approval if whenever is necessary. The plan should include choices for the tenants as to where they would live temporarily, whether that's through a voucher, a hotel stay, or at another one of the owner's properties. So providing choices wherever possible, covering all moving costs, including what it costs to disconnect your services, your utilities, and to reconnect them, deposits, new deposits you have to make. It should include constant communication with the tenants, and that communication needs to start as soon as the owner knows that relocation might be necessary. The communication should come directly from the executive representing the owner. Don't send somebody that doesn't have any decision-making power. That executive should be the one making that communication. And every time something changes, something significant changes, the tenants should be updated by that same executive immediately. Whenever possible, listening sessions should be held to better understand the challenges that tenants will face throughout the relocation. What I did at our housing authority, we redeveloped several of our properties, and so we had a relocation plan and anti-displacement plan. And we started talking to our residents 2 years before any ground broke. One of our principles was that as soon as we find out about a change, that we would immediately communicate that to the tenants. We provided choices wherever possible. And one thing that I'm really, really proud of is, and this was our CEO's idea. I carried it out and finessed it, but he insisted that we create a tenant protection team that was made up of tenants, that was made up of the school district, Austin Energy, transportation, all the type of services that our residents were going to need during relocation. And then we also hired a community advocate that would focus on the tenants' needs. You know, as bureaucrats, we would be concerned about um, creating plans and crunching numbers. And this person's sole responsibility was to think of the residents, the best interests of the residents, and that would be their only priority. So we jokingly called it Give Haka Hell, the Give Haka Hell department, because that was their job. We wanted them to say, Laura, you just designed this, and this is how it's going to impact the residents. You need to make changes. And she'd come to us and show us that, and we immediately made changes. So I think those are the kinds of things that other properties need to do to make sure that tenants are included throughout the entire process and that they're treated with dignity and respect.
Certainly an extraordinary ordeal associated with that development. And I know we'll be asking that same question I just asked you to the other two finalists, but thank you very much for your thorough answer there. If you're just joining us, this is a meet and greet with the finalists for the position of Travis County Executive overseeing Health and Human Services. We're visiting with our first of three finalists, Pilar Sanchez, and in about 10 minutes or so, 8 or 9, 10 minutes, we'll be switching over to our next finalist, and we're giving each finalist the same amount of time, about 30 minutes. You'll also hear several of our questions be repeated to each of the candidates just so they have equal opportunity to answer them all. Pilar, there's an interesting question came in on the Zoom chat. It's a little bit complex, but I think I can deliver it in a way you can understand. Travis County HHS has a long-term commitment to support low-income adults to escape poverty through upskilling. Our region is blessed by strong economic growth, but challenged by an affordability crisis. The MIT, Massachusetts Institute for Technology, Living Wage Calculator estimates a single parent must earn $32.69, I believe that's an hour, to support two children. And please describe your knowledge, experience, and vision for making it possible for low-income adults to upskill sufficiently to reach that goal.
Yeah, that's been very hard to do. I'll be completely honest. You know, it's getting harder and harder here in Austin to be able to afford all the things that we need to be able to raise a family here in Austin. The cost of housing and all our basic needs have gone up. And so what I've done is I've worked closely with the people that know how to do this best. I've worked with the Austin Area Urban League, Goodwill, Skill Point Alliance, Capital Idea, those kinds of organizations that continue to find and improve their solutions to this issue. Is how do you help people train for the jobs of the future, and how do you coach them for them to retain their jobs, right? It's one thing to help with placing somebody in a job, but they need to be able to retain it. They need to continue to learn, and we need to provide them continuous workforce development training so that they can grow in their job and apply for that next better job, and so that they can reach that living wage. It's been difficult, but it's been done, and these organizations have those best solutions. So we need to work with those organizations that have done this and done this well, and we need to invest in wraparound services. So when somebody goes to work, if it's that single mother that you just mentioned in the example, she's going to need transportation assistance, she's going to need childcare assistance, and she's probably going to need tuition assistance so that she can continue to learn and apply for that next level job.
There's so many needs that can collide all at once that have to be addressed in order for that upskilling and you know, wage increase to occur, it seems like. So appreciate that thoughtful response. In the time we have remaining, I think I've just got time to give you one more question, but really appreciate how much you've given us here in this time we've had with you. It's an interesting one that asks a little bit of a personal question. How would you describe yourself as a leader in systems change? How would you describe yourself as a leader in systems change?
Um, I tend to be a visionary, and I tend to be very bold and take risks. We really need to break molds and continue to grow and not use the same playbook every time. We need to be able to have our pulse on the community and understand how our community is evolving and changing so that we can change with it. Um, and so as a leader, I love to take risks and I love to build relationships. Um, Managers will take that vision and run with it and run a program, but we need to not just build programs and systems, we need to build relationships and find the people and the organizations that can best deliver those services and collaborate with them. So I'd say I'm a risk taker, I'm bold, I'm a collaborator, I'm a relationship builder, and I like to say that I'm a coach as well. I love to coach the people that work with me, and I love to push them to grow and learn. And so I'm looking forward to the budget having some career development funds for the staff.
Sounds like a plan. Pilar Sanchez of the Housing Authority, one of our three finalists for the position of County Executive overseeing Health and Human Services here in Travis County. Thank you very much for taking some time to visit with us tonight. We appreciate it.
Thank you, Larry, and thank you for those of you that tuned in.
We will just take a pause for a moment as Pilar will drop out and our next finalist will be joining us, so stick around. This is a special presentation from Travis County as we introduce you to the three finalists for the position of County Executive overseeing Health and Human Services. I'm Larry Schooler hosting tonight. If you have questions for the finalists, we invite you to either in Zoom chat, send a direct message to one of our co-hosts, Shelby Slutzker. Again, in Zoom chat, you can send a question directly over to Shelby Slutzker, who will be collecting the questions for me to see. You can also call us directly. We've got a toll-free number set up for you to speak to one of our team members and provide your question. That number is 800-304 1055. Again, 800-304 1055. You'll be greeted by a member of our team who will take down your question. Just want to caution, as you might guess, we have more questions than we have time tonight. And so we're doing our very best to try to at least hit a variety of topics that were covered in all of the questions we've received. We certainly apologize if we can't get to your question directly, but we're doing our very best to give you as much of a diverse range of topics covered by the candidates as we can. And I'll just reiterate, you will hear some of the same questions here posed to our second finalist that I just posed to Ms. Sanchez so that we can give equitable opportunities to both of all three of the finalists, I should say. So I believe that we will very shortly be saying hello to a current Travis County staff person, the director of the Research and Planning Division inside of Travis County Health and Human Services, Lawrence Lyman. And I see him up on my screen. And I'm supposed to be entirely neutral here, but Lawrence, you and I share the exact same first name. So I just have to salute you for having arguably the finest first name that there is.
Well, anything that helps.
Nice to meet you. Nice to have you here with us.
Okay.
And
Thank you. Glad to be here.
as you probably heard, we've received a ton of questions for you and the other two finalists. And to give everybody sort of equitable opportunity, we wanted to ask you much the same questions that were posed to the prior candidate. So for the audience to be aware of that. But just want to start by asking you what interests you in this position. Why would you like to succeed Sherry Fleming in this role?
Well, I've been part of this department from day one. I have spent my career working in and for this community, and I would like the opportunity to step up to this one last seat in the organization and try to keep us moving forward. I think we've built a really strong, high functioning department. We've got really good morale across our team. I think we're doing a good job serving our community. And I think that I'm really well prepared and well qualified to keep this moving forward.
And that's kind of what I want to dive into with you next. There was a question submitted that asks how your background prepares you to be the best selection for this role. And there was a separate question that you might try to address alongside it, which asks whether you feel you've had similar experiences and can relate to those that HHS serves, and maybe talk more about that. So it's sort of a compound question, Lawrence, about your professional background and how that positions you, but also what kind of lived experience you could tie into your work.
Yeah, okay. I'll try to get to those too. And if I wander, please rein me back in. I mean, background, as I said, I've worked in this field, I've worked in this department, worked in this community for a long time. I have dedicated my professional life to working in this human services space and trying to do the best we can to improve the quality of life for the people for all of our community. Um, and again, I think this is this is what I do. This is what I've committed to. And I think having done this for a long time, I've had a chance to work across the gamut of issues that face our community. I've worked across the breadth of our department. So I understand the activities that go on across all the different divisions, the different parts of our operation. I will admit, from planning, I have not been in direct services, obviously, um, but I have worked closely with my counterparts that do, and have had opportunities in community planning work, um, to talk directly with the not some small portion of the families that we serve, or the families that are like those that we serve. Um, and I obviously, as a white man, I don't have the same lived experience as many of the families we're trying to serve. Um, I haven't seen personally experienced the same kind of challenges, um, but I've tried to listen and try to listen sincerely and try to learn, try to understand, and try to do better. And I think I hope I'm doing a good job at that. Um, you know, s- um, I think we've also, as a department, we tried pretty hard to build a team that is more reflective and does bring to bear the diversity of experiences that we're trying to that our community is experiencing. I think we've done a good job of that. I didn't get the numbers in front of me to quote the demographic makeup of our department or the background, but I think we've done a good job of that. And I think we've tried to actively change um, the way we work to become more reflective and more inclusive of diversity in what we do, and more um, bring a greater understanding of the experience that we're trying to address in our community. We've looked at everything from where we invest in purchasing services and looking at the numbers to see, are we in fact getting services to the communities that need it.
I'm gonna
Um,
I'm gonna step in
sure,
just for a second,
sure.
only because I think you've done a great job of
Okay.
answering the original question, and
Thank
want
you
to get
for
to a topic. No, that's all right.
thanks for reining me in.
Get sure get you to a couple of topics of significant interest. We've got sort of a number of different topics within which our questions fell,
Sure.
and as you might guess. Housing certainly is right there at the top.
Yeah.
A question that was submitted ahead of time reads as follows: the affordable housing crisis and affordability gap continues to widen in Travis County. Name three things you feel Travis County may be able to do to close the housing affordability gap.
Sorry, make a note.
I'll just note also there was a Zoom question that's fairly similar. It references committing ARPA funding, American Rescue Plan funding, to housing and services, and asks how the county should fit into that. So,
Yeah. So, I think about the challenge of affordability in our community. I think about it on two sides. There's what could we do to um, help make things less expensive, and what do we do on the other side to help families have more resources, have more income. A lot of my background is actually on the latter side. I've worked in workforce development for a long time. The whole focus of that entire um, area is to give people the skills that allows them to get better jobs and make more money so they can afford, more likely to afford life in our community. Um, on the other side, obviously there's huge challenges in our community. Just the degree of growth we've experienced um, makes it incredibly difficult to keep up with the demand. And I think we've done a good job. We're trying to do more as a county to help it expand supply. Um, there's a just a fundamental supply and demand issues that we're trying to deal with. If there's just that many more people, then there's not enough to go around, then the price is going to go up. I think so. That's two areas. One is I rethink my thought. One area on the income and earning side. The other side is the supply side, and the third place we work in helping dealing with housing stability is a lot of our direct service and our purchase services that are focused on families that are either on the margins, at risk of becoming homeless, or those that have become homeless. We have the single largest operation in our department is providing rental and utility assistance that are essential for families to remain housed, or mortgage assistance as well. I should add that in. So I think that's the three general areas in which we are active, have been active, and will remain active.
I'm going to go in a slightly different sequence than I went with our previous finalist, but I'll get to everything that we asked her as well. Just because you spoke about dealing with folks that may be at the margins, as you put it. There's a question that came in, and I'm going to try to kind of merge a couple of questions that are similar. Um, One question is mentioning HHS's long-term commitment to supporting low-income adults to escape poverty through upskilling, that person's word, and the MIT, Massachusetts Institute for Technology Living Wage Calculator estimates a single parent has to earn around $32.69 an hour, I would assume this person means, to support two children. And the question is to describe your knowledge, experience, and vision for making it possible for low-income adults to upskill sufficiently to reach this. There was also a question about Travis County paying its lowest wage workers about 15 an hour. What would you do to address that situation if county employees have difficulty living here?
Okay, on the first question, that's really I love that stuff. To be honest, spend a lot of time trying to work on how do programs and how systems work to bridge the gap between individuals in our community that are looking for better opportunities, or trying to reach these better opportunities, and the opportunities that are out there. I think it's something we've looked at for a long time. Is that there've always been a large number of reasonably stable, reasonably high, well-paying jobs that are out there in our community that employers are desperately trying to find people to fill, and there's been a similar number on the other side that could definitely benefit from those opportunities, just don't have the um, missing something to make that connection, whether it's a degree, a formal credential, work experience, whatever. Or frequently it's even basic things like childcare gets in the way, transportation gets in the way, all these sorts of things get in the way. So I think that's the central equation to workforce development and economic development both, is how do we make that work. And I think we've moved very intentionally in our community, um, under the community plan for workforce development, to really focus on grow our own, hire local strategies. That's one of the one of the key things that we can do. And actually it loops back to the affordability challenges. The more we can prepare people that are already here to move the jobs that are growing here, then we don't have to bring more people in. So the people that are already here already have home. Hopefully, we're sort of adding more demand on that. So that's a piece. Um, Sorry, what was the second part of the question?
It referenced the fact that Travis County
Right, right.
pays $15 an hour to some of its employees.
Yeah, yeah. This is how compensation interacts with affordability and retention is a big concern across all the county and all the employers in Travis County. We're all dealing with the same struggle of how do we, pay enough so that our people can live nearby, um, and within the budget we have to live within. Um, Unfortunately, in the county space, we don't have a lot of levers to increase revenue to bring in more money. So, we're dealing with not an entirely fixed pool of resources, but it's pretty tightly constrained right now. So I think it's been a goal for the county, and I certainly share to try to do as much as we can to push that line up because we know how expensive it is here and how much more expensive it's getting very quickly. Um, I think HR has done a real good job in uh, how they look at the market and compensation and trying to build more leverage so that we have a more chance to to keep up at least a little bit to keep our staff on board and keep them within a reasonable definition of affordable. Um, but I think it's just it's just a tricky challenge
Sure.
when your revenue is so fixed.
And certainly your control over wages is would be limited in this role,
Yeah.
but it's helpful to get your perspective on how to
Well,
address the issues.
I think we have to, we get in this, when it's a near zero sum game, you get in a situation of, well, do we pay fewer people more or have more people pay less? And just, the neither equation works very well.
If you're just joining us, this is a special presentation from Travis County meeting the three finalists for the role of county executive overseeing health and human services to replace the retiring Sherry Fleming. I'm Larry Schooler, joined by our second of three finalists, Lawrence Lyman. Again, Lawrence, nice to be joined by you. I'm going to pivot very significantly away from housing, although there are some connections here. But there's a question about how you see the role of HHS working with the criminal justice system, and that's the full extent of the question. How should the Health and Human Services Department work with the criminal justice system?
This is a question we grapple with a lot and have for a long time. Um, there are the issues that we're trying to deal with are so interconnected, and it can be easy to get drawn into everything. And s- so we have to, and it's not just unique to HHS, it's our counterparts in economic development and justice planning and across the board. How do we draw those lines? Because none of us have the bandwidth to cover everything. Um, so we have historically tried to draw what I will admit is a fairly blurry line that HHS really tries to focus on prevention as it relates to the criminal legal system versus getting too involved in what happens within those processes. Um, but I do think we have a responsibility to take on an advocacy role um, because some because of the disproportionate impact of so many of our systems, um, that a lot of the work that we do and a lot of the families we're trying to serve get caught up because of circumstance, become situations beyond their control, and so I think we need to um, be able and willing to advocate um, with an eye on what happens next, because the families, the individuals that are caught up in the courts and in the jails are not always going to be there. They're eventually, hopefully soon, will be back in our community, and they'll be back, in our systems or our related systems, looking for jobs, looking for housing, looking for all these things. So I think we definitely have an interest, and I think it's just a challenge trying to figure out where do we draw the lines and where we're strategic and what that intervention looks like.
I mentioned this to Ms. Sanchez last segment that I got the chance to work on fair chance hiring when I worked
Yeah.
at the city of Austin, and certainly that ties into what both of you and she
Yeah.
referenced there in your answer. So thank you for that. I'm gonna pivot once again to a question that we had that's a little bit more generalized. And the question was, how will you ensure funds are distributed equitably throughout Travis County? And if special funds are received, how will you ensure that these monies are quickly and efficiently distributed?
Um, So in thinking about equitable distribution, we start with a research base. Um, we've done part of the work of my division has always been looking at the data around our community and trying to identify what the conditions are, what the demographics look like, what the distribution of poverty looks like. All these questions, as much as we can with hard data, and try to keep up and have as good a handle as we can on what the data tells us about where, geographically where services are needed, where resources are needed, and also from a demographic perspective, what communities, what populations need service and need help. That's a start. Um, but I think we also have tried to be be active and actively involved in community groups and community planning and other community groups to try to get more qualitative information on what's happening. Because I readily admit I've been labeled as a data guy for a long time, but I rarely admit data only gets you so far. It's a starting point. So I think we have to, continue to be part of those groups around the community, try to understand what's behind the data. What's, is the data misleading us, or is it there finer points or greater needs that are not shown in the data? So I think that's the starting point, or two parts in the process. I think also then, when it comes to actually the investing part, it's just a matter of, we have the 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 responsibility to build in those targets within when we're negotiating contracts, we're putting an RFP together to be clear, this is where services need to go and this is who we need you to reach, and not to take the next best thing and say, look, if you can't get service or your services to community A, B, and C, then we can't work with you. I think also we have to try to maintain some flexibility once we get those contracts in place, that recognize that we have a rapidly changing communities, and the strategy that made sense when the contract started, or when the bids were submitted, 3 or 4 years ago, that we've all seen. I think anybody that's worked in the community for any length of time, we at least when I started, it was everything was what's happening in East Austin in 78702. Well, 78702 that we just talked about when I started working is an entirely different place. So I think it's looking on the front end of where we how do we best identify where the needs are, um, and then designing our investments to accordingly. And the one thing I do need to add is I think we can do a better job um, engaging with more grassroots organizations as well, to make sure that we're you know really getting the full picture. I think Commissioner Trevelyan has been very adamant in talking to us about engaging with those trusted organizations that are closest to the ground in the community, and we got to do a better job in getting that input as well.
Said 78702, I realized that's where my oldest son started his educational journey, over at El Buen Pastor, right there
Yeah.
off Cesar Chavez. So you're right that zip code has changed a good bit. I'm going to stay with this general theme of sort of equitable distribution and priorities. There's a question that reads, how do you prioritize between the full spectrum of all people in needy populations that Travis County HHS serves, internally and through external investments? Specifically, what client populations are the most important to serve?
This definitely gets back in that the resource constraint questions. We would obviously like to do everything for everyone that needs help, and you know we can't do that. And so there's an ongoing discussion in our department right now about what does our investment, and what does this look like going forward. We had a plan a few years ago that really focused on how do we get more resources so we can have a broader reach and not be forced to be as narrow and be narrow as selective. The state legislature implemented revenue caps. It went from 8.5 to 3.5%, which means we don't get a whole lot of new money. And so we're really looking carefully at how do we make the best use of what we've got. Um, and I think there are two sides to that. One is on the targeting of identifying who you want to reach and where you want to reach. And the other side is on the measurement and evaluation side, and making sure that whatever you're doing is working. And if it's not, being able to pivot and move in a different direction. I asked the question of who are the population we need most need to focus on. Um, we have tried to historically, our department has looked at our role in preventing the worst things that would be worse from happening. Sorry, I got tangled up in my
Sorry.
use of the English language there. Um, and for example, we've been part of a continuum around homelessness, for example, where we've really focused on how do we help people prevent people from becoming unhoused. Um, and that's kind of worked okay for a while, but I think we're actually looking at, do we need to dive in more deeply on the rehousing side of the equation? I think clearly the court put a stake in the ground by investing $110 million of ARPA dollars to increase the capacity of supportive housing to help people that are experiencing housing become housed. So clearly that's going to be something we're shifting into. What we've tried to do is as much as possible is, instead of narrowing out who we serve, is try to be really more intentional about make sure we're investing in things that are most likely to work. Um, so I I think I feel now that I've spent the last minute avoiding answering a question and saying
Say
exactly who we need to
it's got to
reach.
be one of the most difficult questions I've ever seen. So I appreciate your efforts to answer it, and you did give us I think
I
a
guess
sense of where your
the
sympathies or
the one
your
last
philosophies.
the one last thing I would add is, I think we have increasingly tried to look at what parts of the community have no one else to rely upon other than the county. So that pushes us to look increasingly at the outskirts of Travis County, the Eastern Crescent, as we frequently refer to it now, as parts that really they can't rely on the city of Boston because they're not in the city of Boston, and those areas are growing in population. So it's a big challenge.
Just want to pause for a moment and reflect on the fact that I see 125 people in our Zoom room as part of this conversation. There are, I'm sure, others who are watching us on TCTV, either on television or on live stream. It's one of many, many, many reasons that I love being a Travis County and Austin resident, because we care so deeply about things like this. So thank you all for being part of this conversation. That's not the end. That's just me noticing a remarkable showing of our community tonight. So um, Lawrence, we're going to have about, say, 8 more minutes just to be equitable in the time sharing. So just to give you that heads up,
Okay.
I'm going to jump over to a question that came in about kind of the circumstances we're in with the COVID-19 pandemic. The question is, a large number of people at Travis County Health and Human Services are working remotely due to COVID. What is the best way to provide quality services in a compassionate manner in this situation?
Hmm. That's I think we are trying to learn how to do that. We spent a lot of time in the last 2 years now, almost 2 years working this way, trying to get better at this. I think we're doing a pretty good job of making the most of the tools we have to remain connected to our community. I think it's a struggle, a challenge for our staff to who are also living through the pandemic and living through all these challenges to try to leave that behind and not bring their own burdens into their interactions with our clients or with our community. Um, I think um, I think a lot of the lessons that you have for any interaction would still apply. I mean, you want to have empathy, you want to be non-judgmental, have empathy for the people you're talking with, and try to listen and hear them where they're coming from and meet them there. I think it's a little bit more difficult when you're in this kind of setting where you don't have the same kind of the same kind of cues, the same kind of context for your interaction. Um, but I think again, it still comes back down to can you listen, and can you really hear what the community is dealing with?
I feel obliged to let folks know that for a brief moment there, my younger son whispered something into my ear in the spirit of listening to our community. That was what I had to do. He's home with some illness. So, Lawrence, apologies for that, but I did hear your answer and appreciate that. I'm going to try to mash a couple of questions together in the interest of time. They both speak to priorities of yours, so a little bit different than funding priorities and more just as a leader. One of the questions was, what do you want to accomplish in your first 6 months if you're selected? And another is, what will your top 3 priorities be if you're selected?
Um, Number one, shortest term is resolution to our questions regarding rental assistance programming. We were fortunate enough to have something in the order of $19 million of federal money come through that allowed us to reach a lot of people in a fairly short period of time. That money's run out. It does not appear that we're getting any more. And so we're really trying to struggle with the challenge of how do we, this is an essential safety net that has to exist in our community. And what do we make that, what are we going to make that work? So that's, my short-term priority. Um, there are, yeah, we have, been working from our team for a couple of years now, trying to ramp up to a fully functioning planning body for our community, looking at substance use disorders and behavioral health slightly more broadly. I think getting that up and running and in place and seeing that process come to fruition and get to the point where we have a plan for substance use disorder and behavioral health, much like we have in our community for early childhood, like we have in our community for workforce development. I want to see that happen. And I think internally, I have some goals um, regarding and looping back to some of the conversation. What can we do about compensation and retention? What tools we have to implement to make us help us remain a competitive employer, so we can get and keep the really good people that we have right now, or get really good people like those we have and keep the ones we got.
Yeah.
So I'll stop there.
Yeah, I appreciate that, only because I do want to sneak one more question in
Sure.
the time we have with you. And it's just phrased, how would you describe yourself as a leader in systems change? How would you describe yourself as a leader in systems change?
So I'll start just maybe divide it in half a little bit. Leadership. I tried to be, um, and I don't know, you'd have to ask my staff if they believe this or not. I try to be a collaborative leader. I try to be a servant leader. You can use whatever term you like, but I want to be part of doing the work. I just don't want to say go do stuff and just and then I'll judge you later. I feel that it's always been incumbent on me to keep my hand in, so to speak, so that I at least have a little bit of ability to still do the actual work that goes on around me. So translating it into system change, um, I want to be part of doing the work. Um, but I think also a lot of the basics that we have around planning are going to apply. What's the information tell us? How do we assess the needs that we're facing in the community, whether it's going back to prior question, um, hard data, quantitative data, formal evaluation data, or qualitative and anecdotal data. How do we understand what's happening in the system? And and I think I've tried to really take an interest-based approach and working with partners to help try to land on get beyond the positions and the entrenched positions, really focus on what are we trying to accomplish here. And I think I'm gathered by your intake, my time is almost up.
No, not at no. Actually, my intake of breath is reflective of the fact that I overlooked a question that we posed to the last finalist that I think is very important, because I know that there are a number of folks tonight listening from the Rosemont community. And so the question essentially was, what is the county and specifically HHS's role in ensuring that tenants in county involved properties like Rosemont and Oak Valley are treated with dignity and respect, and that a situation like what happened there should not occur again? What steps should HHS take to ensure that tenants in county assisted housing are better situated in the future? I'm asked to have you keep it a little bit short, only because we want to give everybody fair time, but it's my fault for not getting you that question
I,
before now.
I think, and I obviously won't go into a lot. There's a lot of legal and formal questions come into play about what we can and can't do. I've been enough of these conversations with the lawyers going at length about what the constraints are. But I think it starts with some of the steps we've taken regarding the board and how that is structured, getting resident representation on the board. I think the next step is to that HHS can do is work with the court to develop some clear expectations and some measurement that we want to see. Maybe it's hard numbers, maybe it's satisfaction, but to build some measurement in so we've got something um, relatively objective that we can point to and say, is the board doing or not doing what we want it to do? I think we can. Um, I think we can have a role, and this is kind of again gets in that space of the resource constraint. How do we want to apply our resources? We can um, build a more formal role of again depending upon what the court wants us to do, but we could have more of a role in direct oversight of operations. We do have some expertise in service delivery and case management that we could apply, and we can also, just simply make the kind of tenant advocacy that's really paid off. I think it's been really helpful for the clients. Make that part of our portfolio more intentionally and write that in when we go out to bid for services. Say we want to invest some amount of dollars to make sure that the residents in these properties that are under Travis County oversight to some degree have access, and make sure that's not just you know something that happens because something really didn't come about because something really bad happened and it was a special case. That it should, we could make that a standard practice to say, look, we want to invest in, whether it's Basta who's currently doing this or any of someone else like that. I don't, I'm not going to, I'm not committing contracts right now, but I think to identify this is a service that we need, and we should, if it's that important to us and the commissioners to do this stuff, we can go and pay for the service and put it on the ground.
Lawrence Lyman, the current director of the Research and Planning Division at Travis County Health and Human Services, and one of the 3 finalists for the role of county executive overseeing HHS. Thank you very much. Great to visit with you.
My pleasure. Thanks for the opportunity.
If you just joined us, this is a special presentation from Travis County as we meet 3 finalists for the role of county executive overseeing health and human services for the county. I'm Larry Schooler, your host tonight. We are about to meet our last finalist, and if you'd like to try to get another question into the finalists, or rather to our last finalist, you can either join us on Zoom and send a chat message directly to Shelby Slutzker, a member of our team who's collecting those questions, or you can call into 800 304 1055, 800 304 1055, and a member of our team will be there to collect your question. As you might imagine, we have more questions than we have time to ask all of them, but we'll do our best to cover as many topics as are covered in the questions that we have received. Well, last and obviously not least is Roberto Duarte, the Executive Director of the Office of Children and Youth in Montgomery County, Pennsylvania. Good evening to you, sir.
Good evening, everyone, and thank you for having me.
Roberto, since I commented on Lawrence's name being the same as my own, I should tell you that I named my second-born son after you. He's Robert, so we have that name affiliation in common. Good choice of name.
That's good. That's great.
For the audience, you will hear some of the same questions posed to Mr. Duarte that I've posed to the other finalists, and Roberto, I'm sure you can understand we want to try to give you equitable opportunity to answer the questions we've asked. The first question is really a basic one. What interested you all the way from Pennsylvania in this role? Why do you want to take the job?
Yes. So when I first looked into the job description, I was quite honestly, I wasn't quite interested when I first looked at the job posting. My interest was more so it developed as I began to do a little bit of research on Travis County, specifically in health and human services. And I noticed that there is a seemingly robust division of research and planning in health and human services. And I believe that many of the decisions that we have to make should be made based on research and actual data. And when I noticed that there was that component to health and human services, a seemingly robust component of research and data gathering, that really sparked my interest. And I think to the benefit of all residents of the county, that is the way that some of the bigger decisions should be made, based on facts, on data, specific needs of the community, and their involvement in as part of the planning process. So those are some of the big takeaways as I was doing research on Travis County. And once I went back to the job application, I it crystallized even more for me because I already have a lot of the experiences and expectations that are required for this job.
And
So
that's actually what I was going to ask you next, is to help us understand how your background positions you best to take the role.
yeah. So as you mentioned earlier, I am already the executive director of the Office of Children and Youth in Montgomery County. I am the person responsible for everything and anything regarding to program, regarding to services provided to our communities. I am the person in charge on hiring, terminations. I am the person responsible for the development of a yearly operational budget for my office. And I know a lot of these skills are necessary to run a health and human services organization, much like Travis County. And I remember that being part of the job description. So I already have experience as an executive leader here in Montgomery County. Uh, Not to mention that I have over 20 years of experience in the field of health and human services working in Philadelphia. And all of that progressive experience, I believe, has prepared me to take on this role of Director of Health and Human Services in Travis County.
Another family connection, a close relative is a graduate of a school in Philadelphia, so I certainly know Montgomery County. And,
Which one?
He went to Penn on the west side.
Penn, yes, that's a very nice school.
I know, though, there's the Big Five, Villanova, St. Joe's.
Yeah.
I understand. It's at Drexel. I get it.
Yeah.
I want to ask you also about your personal, sort of your lived experience a little bit. There was a question that was submitted by a member of the public that asks about, do you feel you have similar experiences and can relate to those served by this department? And if so, tell us more about that. That question also asked how long you have lived in Travis County, and I assume the answer is you have not. Correct me if I'm wrong.
That is correct.
But the other question is, again, if you have lived experience that could allow you to connect with some of the people served by the department.
Yeah, so I will share somewhat of my personal life trajectory, I guess. So I am originally from Puerto Rico. Actually, originally from the Dominican Republic. I was born in the Dominican Republic. And my family migrated to Puerto Rico when I was 13. And we didn't have many of the things that we have today. I grew up in poverty in the Dominican Republic. I know what it's like to experience hunger. I know what it's like not to have all the resources available to live a good life. And so when my family moved to Puerto Rico when I was 13, they worked really, really hard providing for me and my siblings and making sure that we had a good life and a good future. And I really picked up on that, especially from my father, his job, how he viewed his job and his responsibility to his family. So that really stuck with me. And so later I moved to Pennsylvania. I moved to Philadelphia when I was 23, right out of college. I didn't know anything about the city. There was a huge cultural clash because, as you can imagine, Puerto Rico is a fairly homogeneous society. And so coming to Philadelphia, a very different community. So that was a big shock in so many ways, but something that I welcomed. That's really what I wanted to experience when I left Puerto Rico, was to see what else was out there. So I moved here and I experienced a lot of challenges adapting to the culture, navigating the city, also dealing with a very stressful and high demanding job. And I was able to navigate through all of that, all those initial challenges fairly well. And I think I can relate to a lot of those experiences from people who we interface with as part of health and human services professionals. I should also say that when I moved here, I made sure I continue to work really hard, and uh, I put myself through 2 rounds of grad school. I went to have a master's degree in social work and a business degree as well. And so that has been my life trajectory, just really working hard for the things that I want, helping my family. Um, and I feel like in so many ways, I have to give back. I have to give back to those who have helped me be where I am. And part of giving back is the work that I do. The work that I do is very purposeful. I relate very much to the experiences of our consumers, and I try my very best every single day to give everything that I can to make sure that they have a good life and that we can provide the services and make the right social investments for the betterment of their lives. And I apologize if that was a long-winded answer.
No,
but
it's
very
not.
short.
It's actually very helpful to have you share that vulnerably, that level of background. We appreciate that very much. Only in the interest of time am I going to keep us moving to another topic related to housing affordability. And there are going to be a couple of questions here, one more general and one a little bit more specific. But the question that was submitted to us was the affordable housing crisis and affordability gap continue to widen in Travis County. The questioner wants to know 3 things you feel Travis County may be able to do to close the housing affordability gap.
Um, 3 things that the county can do to close the housing affordability. I will be very honest. That is a very complex question. I know that there is a housing affordability problem in particularly in Austin. I've noticed that when I visited last month, and some of the research that I've done tells me that. I don't really I from what I understand, I don't think there's an easy answer to that. Um, but I think it deserves the input of many different stakeholders. Like many of these social issues that I have faced in the past as part of my career, um, I have come to the conclusion that it's always the best approach to really bring all the people who have an interest in um, said problem to the table to have a dialogue as to how we can close this loop or address this housing affordability issue. So I'll be completely honest with you. I'm not going to sit here and pretend that I have the answer to that. Um, we don't have a similar problem here in Montgomery County, though in Philadelphia that is becoming more so of an issue. So I can tell you a little bit what we're doing here, what my office is doing here. Um, we're trying to partner with well, we're not trying, we are partnering with different community organizations right now and doing and making the necessary social investments to create some sort of an infrastructure for those who are experiencing homelessness right now. And we're using funds from the federal government, ARPA, and different resources to bring those investments to the different communities in the county. Um, that's one approach that we are taking. And part of the reason why I bring that up is that um, the conversation has been around a lot of different stakeholders, both internal within Health and Human Services, the county, private community organizations, and even community members uh, are also being brought to the table to have these conversations. Um, so I will say that I think it's a very complex issue. I think I'm sure that if a solution is underway, or at least conversations are happening with those who need to be at the table to uh, to try to address the issue.
And I feel obligated to ask you this next question, though I
Yeah.
suspect that it may be difficult for you as well. There are a number of folks listening tonight who are tenants of a development called Rosemont at Oak Valley, which is you know, an affordable housing area of of this community. And the question that was submitted was, what is the county and specifically Health and Human Services role in ensuring that tenants in county involved properties like Rosemont and Oak Valley are treated with dignity and respect, and a situation like what happened there should not be allowed to occur again. What steps do you think HHS can take to ensure that tenants in county assisted housing are better situated in the future?
I think the first part needs to be that of advocacy and really being a voice for those who don't have a voice at the table, and really bringing their experiences and their circumstances to the forefront of the conversation. Um, I think that's something that certainly needs to happen. That's something that we, at least here in Montgomery County, are very mindful um, of. So I think if you can remind me of the second part of your question, I'm sorry. I think
That's okay. The second part was, what steps can you suggest HHS take to ensure the tenants in county assisted housing are better situated in the future?
mhm. Yeah. So like I said, first I would say advocacy and just bringing these issues to the forefront. And I think it would be necessary to keep the court abreast of um, uh, issues like this. Um, I would add as well that in addition to just advocating for those communities, I think it's important for us to really seek uh, resources and funds to really invest in these different communities in different ways. I don't necessarily mean in housing developments and things like that, but creating jobs and opportunities for people to really elevate themselves and out of poverty or low income. So I think there's a number of ways that we can do that, starting with advocacy and providing the necessary social investments in these communities to really uh, address social determinants of health, essentially, and really make sure that where people work, live, play are healthy environments and are good for good health outcomes. So I think those different investments and bringing that advocacy point to the forefront are crucial in that process.
To stay with the notion of poverty here for just a minute, there was a question posed to us about how Travis County HHS has long supported low income adults escaping poverty through upskilling. The MIT, Massachusetts Institute of Technology Living Wage Calculator, estimates that in Travis County, a single parent has to earn around $32.69 an hour to support two children. And the questioner wants to know about your knowledge, experience, and vision for making it possible for low income adults to upskill sufficiently to reach that threshold.
Mhm. So I would say, um, as I mentioned before, I think there needs to be ongoing investments on social investments and creating opportunities for family to really uplift themselves and lift themselves out of poverty. I think it's an opportunity for us. I think it's an obligation for us to provide those opportunities to the residents of any county, Montgomery County, Travis County. So I think that's really crucial to help these different communities really be able and position themselves uh, in a way that they can provide for themselves and have a sense of autonomy without necessarily us being, Health and Human Services being involved um, for a long period of time. I think our involvement should be short, purposeful, um, and with a robust plan, strategic plan to really address these issues long term. This is not something that we can address um, quickly or easily. So when I mean short term, our involvement being short term is just simply not having to have HHS involvement indefinitely. I think it should be for a period of time, a strategic, purposeful approach with the right social investments to really help people in these communities. We also need to pay really close attention to outdated policies and legislation that really don't align with the current state uh, of what some of these communities are experiencing. And that's something that I've noticed here in Montgomery County, that there are legislative barriers to some of the things that we can do because of these outdated policies, not to mention structural problems or structural barriers in a sense that, when we talk about not just poverty, but say racism, for example, we talk about issues like that and how that permeates uh, 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 the structures of our society. So I think really focusing and being purposeful about all these different areas can really help enable people to really bring themselves out of poverty.
Appreciate the answer there. Just cognizant that we have about 12, 13 minutes left with you, just to be equitable with everybody. And so I want to jump to a kind of a whole different topic, if you will, on criminal justice. Someone submitted a question that says, how do you see the role of Health and Human Services working with the criminal justice system? And that's the entirety of the question.
Mm-hmm. Well, I would say I associate criminal justice as a crucial part of um, social determinants of health. So when you think about social determinants of health and how the environment in which you live have an impact on health outcomes, if you think about, say, crime rates in certain communities, if you're in a community that is riddled with crime and uh, different other social issues, um, then that's going to have a clear effect, a clear effect on that individual's health outcome. So I associate criminal justice in a way that we need to address the behavior or focus on um, some of the individual behaviors so that we can address the collective uh, outcome for social determinants of health. And that, I tie that not just to criminal justice, but the idea also going back to poverty, um, the environment in which you live, where you work, your work conditions. So I think those are all things that I typically associate with social determinants of health, which is where Health and Human Services plays a bigger role.
There is an interesting question that was just presented to me. I probably should wait before I ask it, but I believe that it's appropriate for me to ask this. It's in reference to um, the very well known progressive district attorney. I'm saying progressive. That's the word that was used by the questioner in Philadelphia, Larry Krasner. And the questioner is curious about challenges associated with diverting people from the criminal justice system, especially those living with serious mental illness, intellectual and developmental disabilities, and mental and behavioral health needs. And the questioner wanted to know how you would address those populations here as executive to be sure we have accountability for those services.
Yeah, so there's been a lot of conversations here in Philadelphia regarding Mr. Krasner. So, how to address some of the, if I heard you correctly, behavioral and mental health challenges? Is that correct?
That's essentially yes.
And what was this specific population?
Mentioned people living with serious mental illness, intellectual and developmental disabilities, and mental behavioral health needs.
Mhm. Um, so thinking about that, I think is also, so I will preface by saying I no longer work in Philadelphia. I am the director of in Montgomery County. So, but some of these issues are similar to the ones that we face in Montgomery County. So there's no doubt about that. Some of the ways that we currently address that in my in Health and Human Services in Montgomery County, it's trying to partner, and this is something that we haven't fully figured out yet, but really partnering with all of the offices within Health and Human Services to really target some of the behavioral needs of our residents in the county. Being one of those being substance use disorder, for example, that is big. That has been a big problem for us. Mental health resources has also been an issue for us. So addressing those issues has been a priority for us for, I want to say, maybe the last year and a half, because we have seen an uptick in overdoses in the county, and a lot of our consumers presenting with really serious mental and behavioral health needs. So we are trying to make again, going back to some social investments and putting the right resources where they need to be. We're really trying to bring those resources to the communities as part of our strategic plan, which I should say I played a big part in developing our HHS strategic plan that is currently being rolled out. But for us now, it's really making those purposeful investments when we see these kind of behaviors or issues in different parts of the county, and making sure that we partner with the right stakeholders and the right people within the county and from provider agencies to really bring resolution to some of these problems.
A very complex question, and I hate to limit you in any way in answering it, but I appreciate the answer you gave us on that. Again, a question that just came in. I'm also familiar with Mr. Krasner from, I think, a PBS documentary. A couple of questions that relate to priorities. One question has to do with how would you ensure funds are distributed equitably throughout Travis County? And if special funds are received, how would you ensure those monies are quickly and efficiently distributed? And while I'm on that topic, there was a question related to what client populations are the most important to serve, and how would you prioritize amongst the spectrum of all needy populations? So one is about equitable distribution of funds and efficient distribution of special funds, and another is about where do you see the highest priority need among the needy populations here in Travis County?
Mhm. So I would say monitoring the distribution of funds, that's an ongoing thing, at least for me, all throughout the year as part of my budget process. So we pay very close attention of how our funds are being allocated and what different programs are most of our money. Where is it? What services those funds are being allocated? So we pay very close attention all throughout the year to make sure that we remain on target with all of our expenses and our revenue. We pay very close attention to that. That's our regular operational budget. So that is under ongoing scrutiny all throughout the year. Recently, since COVID, we have also had access. We have had access to a lot of different federal assistance and funds, and so for that, we have been really meticulous at making sure that we understand the criteria to spend those special funds. There's typically, as you probably know, a lot of requirements and criteria when allocating some of those special funds that we have received since COVID. So we try to really understand that criteria. In some instances, we have even hired consultants to help us make the best and most impactful investments from those special funds. So that is, we typically, in the past, I want to say 6 months, we have made those investments based on priority needs in different communities. And that has varied from homelessness, assistance in with drug addiction problems, and a couple of other things that are now escaping my mind. The behavioral health issues and the mental health problems in the county. That has been things that those are a few things that we have tried to prioritize when allocating some of the special funds. And again, we come to that conclusion based on some of the data that we have in our systems, and consulting with outside experts on that matter, but really understanding the needs of the community, and those special funds we try to allocate based on what we know about those communities. In terms of different priorities, your question was what and I'm paraphrasing, what group is it's more important or priority to?
Yeah, amongst the needy populations served by the department here, what client populations are the most important to serve?
So th- I will say this. I don't see any specific population that deserves more attention than um, I would say the family as a whole, right? Not just a specific person within that family, but really what I do on a daily basis, we work with families and we pay very close attention to the needs of the families and the different communities. And so I think focusing on the families, really what you're doing is you're just focusing on everybody, right? You're focusing on all the communities, and by servicing the families, you're really helping the children. You're helping with homelessness. We're helping with uh, food insecurity, job insecurity. When you focus on the family, you really try to do the most comprehensive approach that you can versus just focusing on uh, individual populations. Not to say or oversimplify the needs of individual populations, because that's also very
Sure.
real and it's a big process. It's a big problem, but and it could be a big problem depending on the issue. But I think when we, as a health and human services organization, as a public servant, my job is always to try to maximize the any investment. And the way that I can see our investments have the most impact is by focusing on families.
That's, as a family man myself, an interesting way to look at it. I appreciate the thoughtfulness of the answer. We are very close to time. So I'm going to try to consolidate a couple of questions that we had asked of other candidates, just to make sure you have a chance. Um, there were a couple of questions that relate to sort of what would you do right when you get here? What are your first 6 month goals and your top three priorities? So maybe you could attempt to tackle that in ways other than you have so far, and then I'll try to get one more question to you if I can.
Yeah, so I expect a myriad of different challenges and priorities to be thrown at me. It's part of what I do already, so I am fully aware of that and um, expecting that already. Um, and I have given this question actually quite a bit of thought, and I know I'm going to have a number of different priorities. So I have tried, based on my knowledge of Travis County, try to really develop a list of, if you will, of priorities. And the one that comes to my mind is really uh, uh, understanding the vision that the commissioner's court has for somebody in this role. And one of those priorities is to really understand what their vision is so that I can be an instrument to carry out that vision. That to me is it's a very important thing that I think I need to focus on. Similarly, I need to know who the internal and external stakeholders are. Who is it that I need to know in the county? Who do I need to partner with right away? Um, I also need to know any specific projects, big projects that we're working on. What are the deliverables? What are the timelines? Um, and any due dates or anything like that, so that there is no gap in delivery services in the service delivery, and so that there is an easy transition from Ms. Fleming to me. Um, I also would prioritize, and I know I'm prioritizing a lot of things, but this is has been my experience as an executive director in Montgomery County. There are very often a lot of priorities thrown at me, and so I really have to be thoughtful as to how I prioritize all the priorities. But one thing that I think is very important to me as well is to create partnerships and relationships in the county. especially within HHS. I do want to get an understanding of the culture within HHS, the staff, the morale, you know, how do they see themselves as part of the organization, what matters to them. And so I also want to prioritize getting to know the staff as much as I possibly. I know it's a large organization, so it's could be challenging, but those are some of the priorities that I think are in the forefront of my mind.
Appreciate that. I know there are folks that are members of the union that represents employees at HHS who are interested in hearing what you said there. And just with the very limited time that we have left, there was a question related to how you would describe yourself as a leader in systems change. What kind of leader would you say you are?
Uh, I would describe myself, simply put, as somebody who is very adaptable. I believe that if somebody in my position, you have to be, um, you can't just operate under one um, under one specific set of values. You really have to understand and assess the environment that you're coming into, and really partner and not just assess, but really partner with those in that environment. Um, and so that's where the adaptability comes in, part of the adaptability. And I would say I'm pretty good at that. I I have been very focused for the past 2.5 years in change management within my office, because we have been, to be completely transparent, I have been dealt a very unfair set of deck of cards when I took over this role, and I have been managing an office that has been in so many ways allowed to underperform, and we're underled in so many ways. And so also part of my leadership style is really to pay very close attention to those things that matter to the staff. I like to give them a voice at the table. I like to make sure that they feel as part of the fabric of the organization, because that has allowed me, and I'm talking from my own experience, that has allowed me to develop trust with the staff. Once I develop trust with them and they understand my vision and what I want to do, it is easy to get their buying, and it's easy to manage that change. So that has been, there are two things that I can just quickly answer your question. I would say my leadership style is adaptable, and one that I like to partner with those around me in my immediate environment to make that desired change happen.
I'd have to have you be a guest speaker at my facilitative leadership class at the University of Texas. We'll talk about that offline. But
Sure.
Roberto Duarte is the executive director of the Office of Children and Youth in Montgomery County, Pennsylvania. I was remiss earlier, Roberto, in not telling you that a member of my own staff is a current resident of Montgomery County. So I know she thanks you for your service to the county.
Great,
But
great.
Roberto is the third of three finalists for the role of county executive overseeing health and human services in Travis County. Roberto, thank you so much for joining us. We really do appreciate it.
Thank you. Thank you all, and have a wonderful rest of your day.
We are just about ready to wrap things up here, and I want to take this opportunity to thank the literally more than 100 people just joining us on Zoom, much less those who have been watching us on Travis County Television. And I want to thank the crew over at TCTV for helping us bring this to you tonight, and all of the folks across the county who have been part of this presentation, especially Shannon Weidower and Joyce Miller and our legal team. Also want to thank my colleagues, Shelby, Casey, and Morgan for their assistance in making sure that this could go off without a hitch. You will be wanting, if you'd like, to look out for a submission form that will be eventually available sometime tomorrow at www.traviscountytx.gov/public forum. Again, on the Travis County homepage /public forum, www.traviscountytx.gov/public forum. The county assures me that they will be providing a form for some additional feedback if you'd like to share it, and look out for an announcement both on the website and on the Travis County social media. On behalf of the entire team at Travis County, I want to thank the 3 finalists for putting forward such great presentations to the community tonight. I want to thank the members of the Kearns and West team for their help in making the program go off without a hitch. And most importantly, thank you for joining us tonight, for being part of such an important conversation about the future of Travis County with a new county executive overseeing health and human services. So on behalf of the entire team, I'm Larry Schooler saying thanks for joining us and have a good evening.